Individuals pay thousands of dollars for healthcare every year, yet they remain locked out of owning their own biological history. This diagram shows the disconnected server mainframes that house your data. To reach them, patients must navigate multiple siloed web portals or pay administrative fees just to access their own records. This creates a heavy data courier burden for high-severity chronic patients who are forced to manually transcribe years of complex trauma and medication schedules onto paper clipboards at every new clinic visit. The legacy medical system relies on the unassisted human memory as its primary filing cabinet, an architecture that punishes the sick and the vulnerable. Ramon Rios Jr. approached this problem as both a systems engineer and a lifelong chronic patient navigating epilepsy. Imagine seizing in an ER, unable to tell doctors about the complex mix of medications currently keeping you alive. On that stretcher, Rios saw that the electronic health record was built by administrators for billing departments rather than for the survival of the patient. He began coding a structural, edge-computed fix from a motel room, focusing on local processing that works without a cloud connection. Surviving the critical first mile of emergency care requires a shift in where medical data originates and who possesses the keys to it. HumanOS functions as a true human operating system, built to sit directly between your biology and institutional healthcare. While passive health apps simply track activity, the OSS serves as a sovereign digital filing cabinet that provides patients with enterprise-grade clinical tools. Patient autonomy converts a sick individual from a passive bystander into the active central node of their own health data. This framework bridges the multi-trillion-dollar gap between overloaded clinics and the cognitive fatigue that comes with managing a chronic condition. Skeptical. Vulnerable patients cannot be expected to log sensitive medical data if a corporate entity has the power to sell it to an insurance broker. Aura uses zero-knowledge architecture, processing and storing data exclusively on your physical device. The service provider cannot see or decrypt your information. The mathematical keys never leave your phone's hardware, rendering your medical history completely blind to developers, hackers, and servers. Local-first architecture ensures that medical data is treated as a mathematically enforced human right. The challenge is moving this locked local data to a doctor without reverting to a 20-minute paper clipboard. The QR handshake generates a secure, temporary offline bridge the moment you arrive at the clinic. This handshake beams a perfectly organized medical history directly to the doctor's screen, without requiring complex API integrations or passwords. An API, or Application Programming Interface, is the standard set of rules that allows two different software programs to communicate. This digital transfer eliminates administrative bloat and returns 20 minutes of vital face-to-face care time to the physician and patient. Aura HOS serves as the technological enforcement of a patient's right to their own biological data. This impact reaches from caregivers managing offline dependence to seniors who need to securely bypass medical silos. By providing a universal way to move records between disparate hospitals, the HOS establishes an alternative to the era of the centralized electronic health record. Stop asking broken healthcare institutions for permission to access your own body. Download the foundation and claim your sovereign data today. Eliminating the friction between the patient and the clinic is the only way to prevent the readmissions and misdiagnoses currently bankrupting the healthcare system.